impact on our community, not only in what they do professionally, but what they do outside of those lines, giving back to the community, supporting causes, and really making a difference. And we hope to tell these stories to serve as role models for other companies and businesses to do the same thing, because giving back makes all the difference in the world. And we're here at Cancer Care Specialists of Central Illinois, which was founded by Dr. James Wade, who established a practice in medical oncology in Decatur in 1984. Dr. Wade, thank you, first of all, for having us, and good morning. But talk to us about 1984. Walk us back to that time. How did you end up in Decatur? Why here? And give us some of the backstory.
Well, Brian, thank you, and thank WSOY for coming and joining us here this morning. We are really glad to support WSOY and you, and in particular the Vespers production, and we're very, very proud to be a part of this great community.
Well, you do a lot, and we're going to talk about that. And obviously the Vespers program this Sunday at 7 p.m. We'll be simulcasting this for all the people in, Kirkland holds a lot of folks, but there's, 100,000+ people in the metro area. Not everybody gets to see it, so they'll be able to hear it Sunday evening, courtesy of Cancer Care Specialists. But you go back to 1984, so it's a different lifetime, right?
It was quite different, and we didn't have computers, didn't have cell phones. I got a call in 1983 from Dick Locke, G. Richard Locke.
Absolutely, Dr. Locke.
John's father.
Yeah.
And he said, we really have a need here in Decatur, and I had heard from your program chief, Harvey Gollum at the University of Chicago, that you were thinking of looking at a smaller community, and I was, because I was interested in cancer prevention. And I wanted to come to a community where we could begin a program of looking at what worked for preventing cancer, what worked at finding cancer early. And I thought trying to get my arms around this in a smaller city rather than Chicago would be more practical. And it turned out to be a wonderful fit, and I am so happy that I came here.
All right. So now, in 1984, could you have possibly imagined, as bright as the field was, as smart as the people were there, what we would be looking at sitting here in 2014?
Beyond my comprehension.
Yeah.
And it has grown to what we have now because of a fantastic team and because of the great support from the patients, the families, the doctors in this Central Illinois community.
All right, you
couldn't have done it without teamwork.
Obviously, and you've got a great team here. 4 full-time clinics, 12 weekly or bi-weekly satellite clinics. I mean, you're literally here in Decatur. You're in Effingham. You are in Centralia. You are in a brand new location just opened this year, right?
In Belleville and Swansea, yes.
Yes. Satellite locations in Breeze and Clinton and Fairfield and Flora, Highland, Monticello, Pana, Olney, Shelbyville, Taylorville, and Vandalia. So obviously, when you say Central Illinois, that cuts a pretty big picture there. Talk to me about the experience. And when I remember I was out here for the groundbreaking ceremony for this facility we're sitting in here.
Yes.
Seems like yesterday. But there is a vibe. I'm not sure quite how to describe it. When you enter this building, tranquility, yet some toughness, a team sort of feel. How did you go about creating that atmosphere?
Well, from the beginning, when Dick called me and Dick and Jim McGee and I met, we wanted to bring to Central Illinois the state of the art for people who lived here. And that's been our theme. But what we've learned from our patients and from our families is cancer is local, cancer is personal, and cancer is urgent. And we have to respond to that. So we really try to wrap our arms around this and meet the needs of our patients, our families, and bring to them the very best state-of-the-art, cutting-edge medicine that we can. And we've set up this hub and spoke system because we have to go out to where the patients are. Many of our patients are elderly, infirm. Driving to Decatur to them is a big deal. And so if we can go out to a Taylorville or a Pana and bring a treatment to them so they don't have to travel 30 or 40 miles.
Makes it just that less traumatic.
A huge barrier we overcome by bringing it to the people where they live.
All right, we're in the broadcast business, and our business is not all that much different in that people want what they want, when they want, how they want. I mean, that's today's society. Talk to me about the technology. I mean, in the last 5 years, our world has changed. The way we communicate, the way we consume information. Talk to me about medicine and how it has developed and changed, recently.
So the changes are breathtaking, and the information explosion is astounding because we're learning more every minute than you can read in a lifetime. So the changes in cancer medicine itself are growing exponentially. The groundwork of how do we do this day to day here in central and southern Illinois continues to get better. Electronic medical records, electronic ordering improves our accuracy, our quality. We now have a quality certification from our National Society for the program we're putting on here by meeting a lot of metrics. But we can share information faster, better. Yesterday, I was able to download some images from Springfield to Decatur in 5 minutes, rather than having to send a patient driving to Springfield to pick up a CD and bring it back. I could call radiology in Springfield and say, please send me this data set, and then I could look at it, and we can sit down with the family and say, this is what the problem is, these are the options, and this is how we can help you.
All right, and how much closer are we to identifying it that much quicker because of the technology? And then your original goal and mission, prevention.
So the changes are happening faster than you may realize. In the basement of Decatur Memorial Hospital is a cyclotron, and that cyclotron can make radioactive chemicals. And one of the new chemicals they're making is called C11 choline, which is a unique marker to find prostate cancer. And we now have a research trial approved by the FDA. We are only the second site in the United States that has this, Mayo Clinic in Rochester being the first.
Pretty good list to be on.
Where we can take a patient with prostate cancer where we aren't sure where the cancer is, but we're suspicious it's someplace, and we can inject them with the C11 choline molecule and scan them. And we are in this process of determining how accurately can we find it. In our first patient, it looks like it really hit a home run. So this is something brand new of how the technology is changing so quickly. From the science standpoint, our ability to drill into what a cancer is getting better. We used to think of colon cancer as just one disease, but we are now dissecting it apart. It's probably not one disease. It's probably not 4 diseases. It may be 10 or 20 different diseases. And the tools that we use are getting more sophisticated to be able to approach each one of those differently in a custom-made approach for that patient. We have a study that we're going to be opening up next week where we're testing a new drug that we'd use for melanoma, a skin cancer, for a certain number of patients who have a similar molecular defect in their colon cancer. So as we learn that cancer is more and more complex, like people,
Sure.
We're all related. 99% of our DNA is the same. We're learning that many cancers, colon cancer, skin cancer, may have molecular similarities that we can take advantage of.
Tell me about the art project that's in the front lobby. Yesterday, I posted several pictures on Facebook here this morning of some of the individual pieces and the powerful message that comes through there. Whose idea was that? How did that get started?
So about 8 years ago, we had a grant from a group called ENACT, which is a national organization. We were one of 3 institutions in the country to receive a grant to improve education about research in the community. And we implemented that over 3 years, a great informational project. And we had a little money left over to keep the word out about the importance of research and patients' contribution to that. And so with that, we commissioned Annette Rousseau to come up with an idea of how do we engage patients and art together to memorialize their experience. And she, being, as you know, extraordinarily creative, came up with the idea of these free-floating platform in our waiting room where patients could build the art that could be displayed on a rotating basis. So in our art therapy suite, which is part of the Cancer Center, art therapy students from Millikin come over every day and work with our patients and their families to create these small ceramic tiles and sculptures that they help them make and fire them and glaze them. And then they go on this free-floating display in our office for a period of 30 or 60 or 90 days. And then they get to take them home and put them on their mantelpiece or their wall. So it's always changing.
And there's a new message. It's amazing if you take a few minutes, as I did yesterday, sort of looking individually. The totality of cancer is such a big thing, but you sometimes forget that these are all individuals that are battling this, and that just comes through so personally in the individual messages of the humor, the inspiration. Is that a daily reminder when you walk in?
It's a daily reminder. I love to go and look at it every day. The courage would be the first bullet point for how strong our patients and families are to face this devastating illness and work through it. We know that not everyone makes it. More and more people are. But we know that some don't. But the courage they face this illness, nonetheless, is a lesson to me that I continually relearn every day. Our patients teach us a lot.
All right. Well, Dr. Wade, we really appreciate you having us here today. We're going to meet some of the other folks that make this place happen. And thank you again for your gift to the community. The 7 p.m. performance of Vespers this Sunday will be broadcast live on WSOY, Y103, and both of our streams. So you can listen to it on your iPad or your iPhone or your radio, however you want to do it. It's going to be fantastic. It starts at 7 o'clock. That's this Sunday, December 7th, the 56th annual Millikan University performance of Vespers. Dr. Jim Wade, we appreciate you.
Okay. Thank you, Brian.
We're going to take a break. Here's